When Keith Wynne arrived at the nursing station on the Cashetuan First Nation on July the 17th complaining of back pain, the nurses sent him home with Tylenol and Advil. They didn't help. Over the following month, the 29-year-old made 5 trips to the same Northwestern Ontario medical facility and reported the same symptoms. Each appointment resulted in an offer of painkillers. On the 5th visit, his mother, Jane, demanded that her son be given a blood test. The nurses called the next day. Ms. Wynne said in an interview after recounting the story to a conference on Indigenous health care in Timmins, Ontario, this month. The tests showed something was wrong. Keith was evacuated to Moose Factory and then to a hospital in Kingston, where, on August 30, he was diagnosed with leukemia. He died on October 6. Story continues below advertisement. You have to wait 3 to 4 hours to hear from a doctor, when a nurse in Cashetuan calls a doctor for advice, said Keith's father, Henry. That's really frustrating. Often, he added, it is easier for the nursing staff to dispense the medication than to keep patients waiting for a doctor's diagnosis. The disparity between the health care offered on reserves and the services available in the rest of Canada is well documented. So is the gap in health outcomes between Indigenous people and other Canadians. It is a problem that governments at multiple levels have been grappling with for years. Jane Philpott, the Federal Minister of Indigenous Services, met with the Wynnes at the Timmins conference and has promised that her department will conduct a full review of Keith's case. But in the long run, drive. Philpott said in an interview, the solution is to give First Nations people control over their own health care. That is the main tenet of the deal she struck this year with the Anishinaabe Nation, the political body that represents 49 Northern Ontario First Nations, including Cashetuan. For too long, she said, decisions about Indigenous health care have been made by bureaucrats in places such as Ottawa. Just as in many other sectors of life, what Indigenous people want, deserve and need is self-determination. They need to have control over their health systems, she said. They can make the right decisions in terms of what areas need to be improved and to be put in charge of the data that's gathered so we know where the improvements need to be made. There is no way of knowing whether giving more control of health care delivery to the people of Cashetuan would have led to a quicker diagnosis for Keith Wynne or whether it would have bought him more time. Story continues below advertisement. Story continues below advertisement. But his parents certainly believe he did not get the care he deserved. What happened to my son? He should have been taken care of the first time. That didn't happen, Henry Wynne said. Too many people died in that clinic. The nurses do the best they can, but the thing is, they don't have the stuff they need. The federal government, which is responsible for the delivery of health care on reserves, spent $2,100 per capita for those services in 2016. That includes the cost of things that are not part of primary care, such as public health services.